Bismillah wa salatu wa salam ala rasulillah. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Dr. El-Ghussein. I'm an internist by training, and my area of focus is patient safety and healthcare risk management. And I just wanted to take a few minutes to talk to you about the COVID-19 coronavirus in terms of what to look out for and tips on preventing yourself from getting infected and possibly from transmitting the infection, as well as where we are currently with the virus. As many of you know, the WHO, World Health Organization, has declared COVID-19 a global pandemic, meaning that there's an outbreak of this disease all throughout the world. Approximately 130 to 140 countries are affected by this virus, many of whom have declared national states of emergency. The United States has declared a state of emergency, and even within the United States, individual states like New York and California have declared their own emergencies. And this is really to ramp up their ability to get a response and respond effectively to this outbreak. And what's unique about this COVID-19 virus, which is a strain of a family of viruses called coronavirus, and we've had outbreaks of coronavirus in the past, most notably MERS and SARS that occurred not too long ago. But what's unique about this particular strain is how highly transmissible it is, how quickly it goes from person to person. And the way it does that is through respiratory droplets. When an infected person, somebody who has the virus, coughs or sneezes, and somebody who is unaffected gets in contact with those droplets that come from those coughs or sneezes, either through touching surfaces that those respiratory droplets have landed on, or through the air when the droplets are aerosolized, meaning that they become very, very small and they get into the lungs of an uninfected person. So it's something to look out for. I mean, even though it's on a global scale and a lot of people are affected, the good news is the vast majority of people don't have severe symptoms and recover without really needing much intensive treatment. Around 80%, more than 80% really recover and don't exhibit severe symptoms, but there is a significant minority that do get severe symptoms. Around 4% of people who get infected require critical care treatment. And the people most at risk are people that are elderly, people that are have chronic conditions like lung, heart conditions, people that are diabetic, people that are immunocompromised or are taking or on chemotherapy or some sort of steroid treatment that depresses their immune system. So those are the people that really get affected with the really severe symptoms. So remember this mnemonic, WUTANG. W, wash your hands as much as possible. When you touch something, wash your hands with soap and water, preferably for at least 20 seconds, or use hand sanitizer. Any solution that has 60% or higher isopropyl alcohol. Anything below that really doesn't kill viruses, specifically the COVID-19 virus. So wash your hands, clean your hands as much as possible. You use masks properly. Really, the ones that only should be wearing masks are those who are sick, to prevent them from sneezing or coughing all over the place and getting those respiratory droplets that we talked about all over the place. And B, people that are in contact with confirmed patients with COVID-19. And there's a particular type of mask for healthy people, and it's called the N95 mask. But those are going to be very, very hard to find right now because a lot of them got bought out, and also they're really needed for the frontline healthcare workers like myself who are treating patients and stuff, because those are really, really needed for them. And their particular fit, they have to go around your nose and your mouth to avoid yourself from getting those respiratory droplets in your nose and mouth. T, touch nothing. Try your best not to touch anything. And if you do touch anything, especially if you're traveling and stuff like that in public transportation and what have you, make sure you wash your hands. Avoid large gatherings. The CDC actually came out with a recommendation to avoid any gathering 10 or greater. And there are going to be more and more restrictions on a national level as well as on a state level and probably on a city level for you to avoid those gatherings. And never touch your face, never touch your nose and mouth. And if you do and you have to, make sure you wash your hands beforehand. This is very, very key because you could have touched a surface. You don't know if somebody, those respiratory droplets have been on that surface. So make sure, to avoid touching your face, but also if you're going to have to touch your face, wash your hands. And then G, if you really feel bad, go to the hospital. So if you have those severe symptoms like I talked about, severe shortness of breath, severe shortness of breath, make sure you go to the hospital. So remember, WUTANG, W, wash your hands, U, use the mask properly, T, touch nothing, and if you do, make sure you wash your hands. A, avoid large gatherings. N, never touch your face without washing your hands. And G, if you really feel bad, go to the hospital. And also during these times, make sure you stay calm. There's no need to panic, no need to stress. Stress has been actually shown to lower your immune response, so it doesn't help you from that end as well. So just remain calm, stay cool. That doesn't mean you can just not be alert and not listen to the healthcare professionals out there or what state agencies are telling you and stuff like that. Yes, remain calm, but also be alert, be vigilant. Listen to healthcare professionals, listen to what your state authorities are telling you in terms of disease prevention and what things to avoid. Biggest thing right now is social distancing. Again, if you don't need to be outside, don't go outside. If your work is allowing you to work from home, do it. There's no need to go to work if you're able to do that from home. And last but not least, if you're trying to get information out there, I know there's a lot of things going on the internet, a lot of things that are being posted and stuff like that. Make sure you get your information about this disease from a reliable source. Go to a healthcare professional. That's first and foremost where you should go. If you have a primary care doctor or person that you rely on that's a health professional, get your information from them, or go to the CDC, Center for Disease Control, their website, or the WHO and their website. I'm pretty sure there have been a lot of resources that we can send to you that are good references for information on this. So with that being said, I thank you for your time. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.